I explain to a lot of practitioners too, because heat is the catalyst for PDO. Heat activates PDO. That's why when a lot of people are like, hey, can I go into hot yoga right after treatment? Well, unless you want the results to be short lived, it's going to break down that thread faster. Heat breaks down threads. When I explain about Botox, using Botox prior, which is the perfect protocol, 2 weeks before, it does freeze that muscle, creating less heat. Muscle contraction comes with heat, starts the catalyst, less heat, longer results. So you're just prolonging the results. I love the combination of Botox and PDO.
And they've invested in threads. So they want to make sure that they're not eating away that thread in whatever they're doing. And going into a sauna and working out right after is only going to heat up that skin, and then you're going to get more bruising, right?
Yeah.
So if you want more bruising, go for it. But we're trying not to do that. That's why we recommend a little bit of ice on the area afterwards. Let your skin rest. Let it do its job. Why ruin what you just paid for?
So since we talked about combination treatments, we talked about a little bit of protocols when it came to Botox. Versatility. How versatile do you think PDO is?
For a lot of the consults, a lot of the patients that are coming in, I can use them for building collagen. I can use them for changing scars. So I work in plastic surgery, and we have some people that want to give it the best effort to make scarless procedures. Some people do make scars for whatever reason, and we're helping them out. I put threads underneath scars, and it changes that whole structure of scars. I've changed old scars, something that's been in a face for a good 20 years. And I put threads under there, and have made the scar almost non-visible. It is amazing the versatility that you can do. Also, the versatile use of the thread. What I'm doing for the eyes, I may see that somebody has really crepey skin, and I may have to use an eye thread, a small thread in that area, because their skin is too thin, and we may see a thread. So then I'm shifting. Now I'm doing it underneath the eyes. It's really, you have to think about gauges of the thread and where to put those in the skin. So the versatility of a 30 gauge thread can be used in so many places. The versatility of a 26 gauge thread can be used in so many different places. Something that I'm using for the upper lip, I may use for the neck, and I may help necklace line. The versatility of that is just so open. And that's what creates the artist in us is, wow, where am I going to use this thread? And it's exciting. And you're like, I got a new use for a broom thread or a specialty thread. It's the excitement that creates for the injector. And then you have to think outside of the box. So many people get used to using the same filler for the same area, using this same toxin for this, right? So we've got to think now. The thread world is now open to a lot of versatility. We can use different threads, different areas. We can mix them up. We can use them together. We can use them separate. We can put combinations in. So that makes it much more exciting and better outcomes as well.